using those questions to drive this discussion. If you're watching this live on Facebook and have a question, please ask it in the comments section of this video, and we'll answer questions from live viewers as well. Before we get to questions, I'm going to hand it over to Congressman Hack and then Ms. Kennedy for some opening comments. Congressman Hack?
Thank you, Lauren, very much. Thank you all for joining us. This is the 19th episode of Teletown Hall Conversations about our state and nation's response to the COVID-19 crisis. We've talked to a lot of people, 18 to be specific, lots of doctors, lots of people who are the heads of public agencies. But you know who we haven't talked to yet is somebody who actually day in and day out, hands-on, clinically provides frontline care to people who are suffering from the infection known as COVID-19. Today, we are very privileged and grateful to have with us Heidi Kennedy, a registered nurse, a full-time faculty member, as well as a practicing registered nurse, who indeed works in an ICU unit with COVID-19 patients. And so Heidi, thank you so very, very much for being here. I just have to say that the way I would like to begin this conversation is having you talk about what it's like. What is your day like? What are these experiences like working with people that have been infected by COVID-19?
First of all, thank you so much for having me. My hope is that I can accurately represent the experiences that my coworkers and I have been having as COVID nurses. This is not a role that anything has ever prepared any of us for. I don't think, I never imagined that I would be actively nursing on a unit during a pandemic. Essentially, working as a nurse on a COVID-19 unit is one of the most challenging emotionally and physically things that I think that I've ever done. So we have in my facility a 40-bed unit that is designated for COVID-19 patients. On average, we have about 10 to 15 patients who are at the ICU level of care, which means that they are on either mechanical ventilation. We've heard a lot about ventilation or ventilators since the very beginning of this, or they're requiring very high levels of oxygen support via mechanisms called BiPAP, which is a pressure ventilation, external ventilation system. It's like a CPAP mask that someone might wear for sleep apnea. It's similar to that. Or requiring high pressure oxygen through a large nasal oxygen device, like a nasal cannula. You see the little prongs that go in and goes around their ears. And then normally we'll have about 15 patients who are not quite as sick as that, but they're still needing a little bit of oxygen support, or we're concerned they're going to get sicker, so they're on a slightly different level of care on the unit. And then the last number of beds are normally filled with patients who are being closely monitored for worsening COVID symptoms. Either they are not requiring any oxygen, or they might require oxygen, or they're members of populations that are at very high risk, such as the elderly population or those with pre-existing conditions. And we are normally packed full at this point. We actually just opened up an additional, I believe, 15 to 20 beds for those patients who are essentially being at the kind of monitoring lower level of care. So that is kind of what our unit looks like. There have been some I would say a rapid increase since March in the amount of pretty invasive therapies that we're having to do to try to keep people alive once they're severely affected with COVID-19. Some of these therapies include continuous renal replacement therapy, which is like dialysis for kidney failure, but it runs 24 hours a day and requires one-to-one nurse monitoring. A nurse has to be in the room with the patient literally 24 hours a day while the machine is running to make sure that nothing goes wrong.
Heidi, physically next to the patient, not
physically next to the patient, not another room through a window. Nope, sitting in the bed sitting in the room at the bedside of the patient. Which
why is that
obviously
necessary?
It's a very high risk procedure. It involves continuous circulation of blood from the patient to a essentially dialysis filter. We use it for kidney failure. And one of the things we're seeing in COVID-19 is multi-organ system failure. It may start out with a cough and a cold-like symptom, but eventually the body starts to progress and other organs begin to fail. And one of the organs that fails is the kidney. And often the people who are experiencing severe COVID-19, they start to have blood pressure problems. Their blood pressures will go very low. So they can't tolerate traditional hemodialysis, which we do for people with end-stage renal disease or kidney failure, where you can go to a clinic and have dialysis performed there. They can't tolerate this kind of treatment. And so it's such a high risk procedure that a nurse has to be in the room at the bedside while the machine is running. If, for example, if a cannula or an IV line, these IV lines are about this big, if that was to disconnect, a patient could exsanguinate or bleed out in less than a minute. So someone has to be in there at all times, which, needless to say, means that a nurse is in a room with a COVID patient in protective gear for 12 hours at a time. It's really
Are your
challenging.
shifts 12 hours, Heidi?
Yes. I believe the majority of facilities in this area use 12-hour shifts for most of their nurses.
And tell me about your sense of personal safety as it relates to the amount of personal protective equipment that you have.
I think that in Washington, we need to be a little bit more transparent. Our hospitals need to be a little bit more transparent about how much PPE is actually available to us. We deserve to know how much we have on hand at all times. And I know that some facilities are doing well, but some facilities really aren't. We still have to use one N95 per day and one surgical mask per day, and respirator shields are used until they are not usable anymore. And we would love to know if there are strategies and plans in place to secure adequate protective equipment so we can use this equipment as it was intended, which is single use only, and stop this never ending conserve all your PPE initiative. We've been conserving since March. We've been using PPE that is single use, kind of feels indefinitely since COVID really started. And I would love to see some strategies and plans in place to secure adequate PPE for our frontline workers, and not just in healthcare. I'm talking, people who work in retail and work with the public every single day. They deserve to have adequate PPE as well, and to know how much PPE is available to them and what the plans are in place for the future.
So Heidi, if I understood you correctly, you both have an N95 mask on and then a plastic shield in addition to that?
We have a few different things. So we have surgical masks, which are the basic mask you see doctors wearing in movies. It goes across the face and behind the ears. And then we have the N95 respirator, which is the kind of mask you use when you're kind of sanding or doing any work in the garage. And when we are wearing an N95, we also wear a face shield. It goes just a plastic face shield. At my facility, we also have a respirator called a capper. We also have a PAPR. They're both just mechanical respirators, essentially, hoods that go over the face and provide positive pressure filtration of the air so that you can, so that you're not breathing in any aerosolized particles. And if I'm basically, the problem with N95s is not everyone fits into N95s. You have to be actually fitted for them. And if your face is shaped in such a way that it doesn't fit the N95s, you can't use them. They're not going to protect you against aerosolized particles, in which case we would utilize the respirators, which are the cappers or the PAPRs.
So you'd indicated earlier that during your training and your earlier professional career, you never imagined that you'd be giving ongoing health care to patients during a pandemic. But in fact, you've been doing this now for what, 5 months, March, April, May, June,
Yeah.
July.
Since
certainly
it's been
never-
since early March. Mhm.
You certainly didn't anticipate that this would be going on and will be going on a while yet. So first, I want to ask two questions now.
Mhm.
Do you feel safe? Number one. And number two, the conditions that you describe for the patient that can progress to those points seem incredibly severe.
Mhm.
And there is a lot about the conversation about COVID-19 that suggests it's like the flu and not everybody gets real sick. But that's not what I'm hearing your description of patient conditions getting to. So do you feel safe? And secondly, tell us how serious you think this virus is.
I think I would feel a lot safer, and come back to the same thing I mentioned earlier, if I knew that PPE was going to be available for the immediate, for not just the immediate future, but for months down the road. I think I would feel a lot safer. Right now, I feel a little uncomfortable using the same surgical mask and the same N95 over and over and over, sometimes for more than one day. I feel that something needs to be done. We can't continue doing this constant reusing of PPE over and over again, because something somewhere is going to break down, something's going to fail, and people are going to get sick. I think there are things that could be done to make us feel safer, but right now those things really aren't being done as well as they could be. I think I would feel a lot safer if people were a little bit more dedicated to wearing masks outside their homes. I think we've seen a lot that's shown us how important masking is and wearing masks in public places. And I think that would also make me feel a lot safer in the long run. But I would really like to know how much PPE is available for us and how much will be available in the future.
We should mention that by prior agreement, we're not revealing or disclosing the exact hospital at which you work.
Yes.
I do
Correct.
think, however, it is worth noting that of the direct patient care in excess on average nationally, about 83% of it is provided by a registered nurse.
Yes.
And the balance by a physician. Also, as it relates to mask wearing, would note the news report out today, University of Washington now projecting that by the end of the year, the number of fatalities associated with COVID-19 will increase to nearly 300,000, and from the current level of just under 160,000, as I recall. And they project that 60,000 fewer lives would be lost if 95% of the public would simply mask up. So back to the second question, if you would please, Heidi, about the severity of this virus.
I will say that yes, we do see patients who are elderly and have what we call pre-existing conditions who are dying from this virus, and patients who, are very chronically ill, are really struggling with this virus. However, we are seeing a lot of young adults come in, people who are in their 20s and 30s, and without any of these pre-existing risk factors, and they are still incredibly, incredibly ill. And the list of risk factors and pre-existing conditions that we are identifying that lead to susceptibility to this virus seems like it's getting longer every single day. I mean, just last month, obesity with a BMI greater than 35 was added to the list of risk factors that can lead to susceptibility to this virus.
BMI standing for body mass
index. Yes, thank you. Yeah. Which is unfortunate because the United States does have a significant portion of the population who struggles with being overweight, and it adds a huge dimension to who is at risk for being very seriously ill with this virus. We have had patients in their early 20s who were hospitalized for 2.5 months on mechanical ventilation, on blood pressure support, on countless medications to try to open up their lungs and heal their lungs and have them breathing normally again. And it's been shocking because these aren't the normal kind of patients we see in the ICU struggling to breathe and on ventilators for 40 days.
And it's not just the elderly, as we learned.
Not just the elderly.
Earlier today or yesterday, I believe, tragically, a 19-year-old lost his life due to COVID-19. I don't believe there was any indication of pre-existing conditions in his case. In fact, as I recall, it was indicated that he was an exceptional athlete in some regards. So it's not just the elderly. Lauren, why don't we bring in a question or two from people who pre-submitted or maybe watching live now, if you would, please.
Absolutely. Our first question is coming from Eric in Olympia. There are serious long-term health problems with coronavirus survivors. Where can I find statistics on these outcomes for both Washington and the US, and what do they include? Ms. Kennedy?
That is a question that I actually don't know the answer to. I myself would refer to the CDC and their numbers for reporting.
I think going to the CD.
Yeah,
go ahead.
And we don't really know what the long-term effects of this virus are so far. So it's really, for me, at least, it's hard to tell. That data hasn't really been reported yet.
I would recommend going to the CDC site and maybe even going to the state site related to coronavirus. And while we are talking, Lauren, maybe you can get that website address. We've used it before. I think it's at the State Department of Health, but why don't you dig that up if you would, please? And we'll share that information with Eric. Another question.
Great. Our next question is from Stephen in Olympia. Although Washington State has done a bit better than other states, it looks like we will be in this for quite the long haul with more sheltering in place in order. Given federal benefits run out at the end of July, what would be the plan to support and encourage the general working age public to stay home and still be able to pay rent, buy groceries, etc.? Are masks and social distancing and hand washing enough? Congressman Hack, would you like to answer first?
Yes, I would be glad to, and thanks for the question. Well, the immediate plan is to extend those benefits. Now, we don't know whether that's going to happen as we're having this conversation. Obviously, there are difficult negotiations between Speaker Pelosi, Senator Schumer, Senator McConnell, and Secretary of Treasury Mnuchin on behalf of the White House about an extended package. In May, the House passed the HEROES Act, which provided for an extension of unemployment compensation benefits until we can get to the other side of this circumstance. There is some receptivity being indicated by the other parties to this, but on a woefully inadequate basis, frankly, because there is a lot that needs to be done, not just the extension of unemployment compensation benefits. I hope, in a minor way, cautiously optimistic, that there is such a dire circumstance confronting the average American that we will be, that those who are thus far resisting doing anything additional will be compelled to at some point. And the sooner the better, frankly, because you're right, we not only have passed the unemployment compensation added benefit bonus timeline, but we have also passed the federal moratorium on evictions. And although that process will take 30 days with court filings and the like, so it's not like somebody's going to be kicked to the curb tomorrow, but the process will begin and may have already begun in some instances. So I think the plan is to continue to fight for as much of the elements of the HEROES Act, which, by the way, contained a provision to provide bonus pay to those who day in and day out, like Heidi, literally risk their lives to provide patient care. I think that's the minimum we should expect. It also included an element, frankly, that compelled the use of the Defense Production Act for the production of personal protective equipment. As we all know, President Trump was extremely resistant to utilizing the powers of the Defense Production Act to create the manufacturing of a sufficient amount of PPE for frontline workers and essential workers. That was included in the HEROES Act. Difficult negotiations underway. Keep your fingers crossed. You asked about also socially distancing and masking up. I already shared with you some of the data about how effective the experts say masking up will be and how it could significantly reduce the amount of infections among the population. Literally, they project we could save 60,000 lives between now and the end of the year if 95% of the public were to mask up, socially distance, mask up, wash your hands a lot, and pay attention to what the public health experts and people like Heidi are saying are necessary to keep you and your family safe. Heidi, do you have anything you want to add to the gentleman's question?
Sure, I'd love to mention, for example, in regards to masking in Yakima County, the population there in between June and July went from 35% of people wearing masks to 95% of people wearing masks. And the number of cases in Yakima County have actually dropped significantly between that period of time and now. And there's some really good data from the Yakima Herald that was published just recently, if anyone wants to look further into it. But I think that alone, that really stands to the efficacy of masks. It's the simplest thing we can do to help protect ourselves and those around us. And I would really recommend that and strongly encourage everyone just to do this one simple act and try to save a few lives here and there.
Good. Lauren.
Thank you. Our next question comes from Antoinette, who is watching live.
Lauren, I have to say, I believe Antoinette has watched just about every time and had really good questions every time. So if that's the same Antoinette that's been watching and asking questions before, Antoinette, thank you very much for tuning in. Lauren, what is her question?
Absolutely. Her question is, I have several family members who work as EMTs and nurses, firefighters, and law enforcement. What is Washington doing to prevent a scenario like what we faced with this virus and a possible next pandemic? PPE stockpiling? Congressman Hack?
Well, I can assure you, because I talk to him every week as well as the rest of the congressional delegation, this is almost the entire sole focus of Governor Inslee to mobilize our resources on behalf of providing as much PPE as possible to people who are in need of it. But I have to say, that this is not something, the production and movement of PPE equipment throughout the country that respects state borders. And therefore what we need is a national strategy and the authority that is contained in the Defense Production Act. The governor does not have anywhere near the authority as contained in the Defense Production Act to mobilize manufacturing capacity to this end. He has a lot of power under the law when he declares an emergency, but he cannot compel companies to produce PPE. The President of the United States can do that. He's largely not done that. He needs to do that. That's why we included it in the HEROES Act. We are behind. There is nobody that should go to work any day worrying about whether or not when they show up is there going to be adequate personal protective gear to keep them safe as they provide a vital function or provide us all with essential work, as the phrase has now become known. Heidi should not have to get up in the morning and think, am I going to have to go use my N95 again today? And is today the day it's going to fail? There's just no reason why any of us who, God forbid, would be lying on that bed so dependent on her care, want her to have that as a top of mind worry when we are sick. She shouldn't have to have that worry. Thank you for the question, Antoinette. I'm guessing, Heidi, you're going to want to weigh in on this one too, and I'm hoping you are.
Well, I agree completely with actually everything you've said regarding a stockpile and making plans to prevent this from ever happening again and putting us in the positions that we've been in. And reflecting off just what you were saying regarding, having available PPE. For example, I personally have one remaining N95 in my size that fits me. And when that N95 has been used, will have to go back to using a capper, the respirator helmet that I talked about. And I have no idea how many capper shields, which are the disposable and reusable part of that, are available. How long am I going to have access to PPE? I have absolutely no idea, because my one N95 is about to be used up the next day I go to work. It would absolutely be beneficial to have resources in place to make sure this never happens again, and our essential workers are never placed in this situation ever again.
Hear, hear on that. Lauren.
Thank you. Our next question comes from Martin in Olympia and was sent in through constituent mail. I'm concerned about the lack of response by OSHA. CDC only has the authority to do research and publish recommendations. OSHA has responsibility to ensure safe workplaces through enforceable rules. What can you or your contacts do to compel OSHA to update their workplace safety criteria to substantively address COVID? Congressman Heck?
Great question, Martin. The answer to it is compel them to do it. In fact, that's exactly what we did in the HEROES Act that was passed in May. We compelled the U.S. Department of Labor to develop OSHA standards of a consistent and adequate level for the protection of essential workers and healthcare providers. The truth is that there have been in excess of, and you're hearing this number correctly, 6,000 complaints filed with OSHA about inadequate measures to protect workers. So again, it was a feature of the HEROES Act, passed in May, still awaiting any kind of a response from the United States Senate to respond favorably to this. The signals are not good in this regard. Instead, what the response has been is they say we need to pass liability protection for employers so that if a worker does get sick, then it's no fault of theirs, even in the absence of standards. So we're going to continue to fight this fight, Martin. There ought to be OSHA developed standards, and we hope that will be a part of any final deal that is negotiated with the Senate.
Thank
Lauren.
you. Our next comment comes.
May I speak to that briefly?
Absolutely.
Thank you. The Washington State Nurses Association has been fighting very hard to have employers recognize that COVID needs to be considered a condition that employees need to be protected from. And one of the biggest concerns and discrepancies that we're facing is that if, for example, if a healthcare worker is, obviously we're seeing COVID every single day, but if we are actively exposed to COVID at work, we are essentially having to use our own paid time off and our own extended illness time to quarantine. And if we are waiting for a test result to come back, we are still having to use our own time to cover for those days we are not at work. And some facilities are actually even saying, even if you've gotten a test, if you are not symptomatic, come on back to work. It's fine. I think that's setting
even
a very
if you've gotten a positive test.
Well, if you've gotten a test and you're waiting for results.
Okay.
The guidelines are if you've gotten a test and you're waiting for results, you should quarantine for that time period while you're waiting for those results to come back. And I know some facilities are saying it's fine, come back to work while you're waiting for those results as long as you remain asymptomatic. And I think that's setting a very dangerous precedent because it's discouraging healthcare workers to get tested because we're having to use our own time off that we've accrued. Example, our extended illness time, that's time that's meant to be used for, if a short, like essentially almost like a short-term disability, you break a finger, you can't go to work, you can, for extended period of time, you can use your extended illness time. But we're having to use this time to cover our quarantining or our COVID illness time. And I think that's just probably going to discourage healthcare workers to get tested. I think that's setting a dangerous precedent. And hospitals and facilities really need to start doing more to protect their employees. And I would love to see OSHA weigh in on this and see some action there, but we're just not seeing anything.
And this is true, i.e. a requirement that you use your own extended leave time if your exposure to the virus was inarguably in the workplace.
I don't know how they could prove it would have come from the workplace, but I can foresee them saying, well, there's no way to prove that it did come from the workplace. There's no way to prove that it didn't come from the workplace, or that you were exposed in the community. And that's where I can see the discrepancy lying.
So I want to acknowledge and admit another frustration level I have, which is almost comparable to that with the failure for us to mobilize and create sufficient amounts of personal protective equipment. And that is what an incredibly botched job we've done on ramping up testing. It is inexplicable to me that we have not mobilized the resources to provide a sufficient amount of testing and accurate, timely responses. It will be written upon not very favorably in the history books of this once great nation in that regard, blowing it.
Yeah,
No other way to
I do
put it.
agree. I think testing needs to be much more acceptable, or excuse me, not acceptable. Testing needs to be much more accessible to those who need it. And it shouldn't cost nearly as much money as it does for those who need testing.
Lauren.
Thank you. This comment comes from Karen in Edgewood and was sent in through constituent mail. I have an idea. Many nurses are out of work and there are many medically fragile adults and children sheltering at home with only their family members caring for them. These out of work nurses could be providing respite for these families caring for their loved ones at home. There needs to be funding to pay these nurses to provide respite for these families. Ms. Kennedy, would you like to comment on that?
I think that's a very interesting idea. I don't know how it would play out in practice, given that there are so many different roles in nursing. A nurse, unfortunately, a nurse is not just a nurse. I, for example, never would be able to walk into a labor and delivery unit and deliver a baby. That is not feasible for me. And in saying that, you know, all out of work nurses can just go and provide respite care for COVID-19 patients, probably wouldn't necessarily be feasible. But given that, it might be kind of interesting to provide a program for nurses who want to go out and essentially volunteer to work with these families and provide this care almost in a home health kind of basis, because what you're describing sounds like home health. And providing any kind of stimulus package for home health during COVID-19 would be pretty great, because home health is a really understaffed and underfunded division of care as is. Medicare is significantly, in my opinion, Medicare significantly underfunds home health and hospice nursing. So if they wanted to create a federal stimulus package to encourage nurses who are seeing low hours at work or out of work to go into home health and serve their communities that way, I think that would be a really wonderful package to have.
I think it's a fascinating and provocative idea. And just to give a little context to it, when the COVID-19 virus first arrived, one of the reactions in anticipation of our ICU beds being completely filled up by COVID-19 patients was to scale back significantly on elective surgeries and a lot of other kinds of things that were normally offered. What that caused to happen was a huge reduction in employed healthcare professionals. They were laid off because there was not the work. We are still down from the beginning of this virus, some 750,000 healthcare professionals in this country. So there's no doubt that there are a lot of people not working today that are trained and credentialed that could provide some aspect of healthcare service to people. Whether they can deliver a baby or provide home health, of course, would have to be sorted out in a very assiduous fashion. Lauren.
Thank you. Our next question comes from Julian, who is watching live. Is consideration being given to hazard pay for frontline medical workers? When I was combat deployed to Afghanistan for Operation Enduring Freedom, our pay was augmented with hazard pay. Would or could the federal government consider augmenting pay for medical workers? Congressman Heck?
Well, Julian, first of all, thank you for your service very much. And the answer is yes. Again, I'm going to take you back to the HEROES Act, passed in May by the House of Representatives, and awaiting action in the US Senate or some version of it in a negotiated settlement. It did include a $13 per hour addition up to a certain level for frontline healthcare workers who are being exposed to this kind of danger, as is Heidi, on a day in and day out basis. And from my perspective, it's the least we can do for people who are actually stepping into the breach of a much more pronounced hazard than any of them ever anticipated, and through no fault of their own.
We in the healthcare field, we have been fighting for hazard pay, like Congressman Heck said, since the beginning of this. In my thoughts, hazard pay is does not serve as a substitute for safe working conditions and PPE, but it does serve as a recognition for what we're doing and the hazards that we are facing every day we're going to work. We are making significant sacrifices that were completely unexpected. And we've been doing this essentially nonstop since March. You know, hazard pay is something that would provide some semblance of relief to those of us who have been and are the only sources of income in our families during these times of job insecurity. So I think that it would be a very good way to serve as recognition for the frontline workers who have been fighting this since it began.
Lauren.
Thank you.
Well put, Heidi.
Thank you.
Our next question comes from Julie in Lakewood and was sent in through constituent mail. We can't go back to school. It's not safe. As a teacher, I do appreciate the sentiment, but we are actually fighting a virus. The number of infections are going up, as are the number of COVID-related deaths. Going back in a building puts kids at risk, and it puts their families and teachers at greater risk. I urge you to support doing whatever it takes to protect our kids, their families, and our educators. The path to recovery goes straight through America's public schools. Congressman Heck, would you like to comment first?
Sure. Julie, thanks very much for the question. Thank you for the work you do every day as a teacher. I probably would assume you would know that I'm married to a retired teacher and principal. It's an important part of our life and our values. You no doubt know by now that the chief medical officer for the Pierce County Health Department and the Thurston County Health Department did in fact issue a statement saying it's not safe to go back to schools, exactly as you suggest. And as a consequence, all of the school districts that I am aware of, at least in the 10th Congressional District, which I have the privilege to represent, will be opening school on a remote or distant learning basis. We all recognize that in-person learning is more effective and more important, or more effective than distance learning. And we all recognize that there are some people for whom distance learning is going to create a real problem. And I think we should acknowledge those as we embrace doing the safe thing here that the data suggests, namely being in school now is not safe, but that there will be problems. There are significant equity problems. And what I mean by that is people who can't afford the device to do distance learning, people who can't afford the connectivity, they don't have broadband access, special needs students for whom online learning just is not going to work. And the younger you get, the more difficult it is for distant learning to be an effective form of instruction. There are going to be real problems here. There's no question about it. School districts have been scrambling like you cannot believe over the summer and spring to make sure that as many kids as possible, if not all, have devices and have connectivity, but there will be holes, just as there will be holes in the ability to provide an appropriate education to students with special needs. But as you suggest, the healthcare experts have said, for now, it's not safe. And so most of them have made the decision not to return to school, at least until after the first of the year. We will see if we can do this on a safe basis. You probably followed the news report that New York is opening its schools. That is because they got their R naught number way down. I'm not going to get into the technical terms of what that means. It has to do with the spread. And they have, through the adoption of masking and social distancing and other measures, managed to get the rate of the spread of infection down significantly. But it's precarious. I mean, they're going to try it, and we'll see if it triggers another spread of the infection or the virus going forward. And we will hope that their measures will contain it, and that as we employ them more vigorously, more broadly, more deeply, that we will get to the point where we can return to the more effective in-person instruction. Heidi, you want to add anything about schools?
Well, this is not my personal area of expertise, but I would have to agree with you, Representative, on the fact that right now it isn't safe. But my concern is the equity access for students to ensure they have the means to succeed from learning at home. And it comes with all these additional challenges of students who are have food insecurities, and how are we going to support, though I don't, that's not my area of expertise, like I said, but those are concerns I have for the students as well. And I'm hoping that we can make the best choices we can for our kids and our teachers. And they're such an integral part of our community and our society, and keep them safe as long as we can.
This is a very difficult circumstance. And the truth of the matter is, whatever decision or whatever path is chosen to go forward has downsides to it. The more we have to shelter in place, the harder the impact on the economy. That's not an abstract concept. What that means is people have less income. What that means is somebody who built a small business over time may be significantly at risk of losing it, even if they haven't already. On the other hand, the more you open up when it's not safe, the more the virus will spread. And then it won't be an executive order that closes down the economy. It will be the aggregated decisions of individuals who say, I'm not going out because it isn't safe. And so there isn't a good answer here. There is only a less bad answer here. Lauren. Heidi.
Thank you.
I said I agree entirely with that sentiment.
Thank you. Our next comment comes from Lisa in Olympia. I want to thank you for co-sponsoring two important pieces of legislation that will protect one of our most fundamental freedoms, the right to choose our leaders in open and fair elections. I support both HR 92 and HR 6202 and appreciate that you are a co-sponsor of both. Washington State is a leader in ensuring that every citizen can vote, and I appreciate that you are championing this effort in the House. Congressman Heck?
Was that Lisa that asked, Lauren?
Yes.
Thank you, Lisa. This is an almost difficult subject for me to talk about in the immediate aftermath of the loss of my friend and that great American icon, John Lewis, whose life was devoted in many ways, not just to the broader cause of civil rights, but specifically to the cause of voting rights. Our vote is our power. It is our voice. And there are many efforts afoot in this land to discourage us, to deter us, to suppress us exercising our power. So thank you very much for that. This is fairly foundational. This is at the heart of who we are, after all, as a democracy, that each and every person should have the right to exercise their vote as conveniently as is possible. And Lisa, don't you get a little bit of a kick out of all the fuss about potential fraud in mail voting, a system that we've been using in Washington State for 10 years, virtually error-free, certainly as error-free as in-person voting ever was. And I can remember when it first arrived, I was a little uncomfortable, not with the potential for fraud, but because I love the ritual of going to the local schoolhouse and going into the voting booth. It just made me feel good to exercise my right to vote, as opposed to letting it sit on the kitchen table and pondering it before actually filling it out and sending it in. Initially, I made the mistake of filling my ballot out almost as soon as I got it. And that was a mistake because an awful lot of information about the candidates or the ballot propositions comes late. And I found on occasion or two that my mind would have actually been changed by the information I got after I submitted my vote. So I've gotten a little bit more conservative about how it is or when it is that I submit my ballot to make sure I have all the information available to me. Thank you for your kind comments about my sponsorship of those measures. I just feel so strongly about it, about, well, frankly, all, you know, when you represent a district, when you have the privilege to represent a district that includes Joint Base Lewis McChord and the 55,000 people per day who report to work there, and you think about their willingness, they're volunteering because they're all volunteers, to put on the nation's uniform and potentially put themselves in harm's way in furtherance of fundamental American values. No more fundamental one is the right to freely vote.
Thank you. Our next question is coming from Michael, who is watching live. Are any medical specialists or nurses unemployed resulting from for-profit clinics and hospitals dealing with emergency priorities? Ms. Kennedy, would you like to respond first?
I can say that earlier in the COVID crisis, when all essentially what they were calling non-emergent or non-essential procedures were canceled or rescheduled, a lot of specialty services such as operating room and PACU or post-anesthesia care, nurses were furloughed or essentially out of work. We were also seeing a significant reduction of emergency room visits, which were lowering the amount of beds we had filled in the hospital, which was resulting in nurses being furloughed. I've also recently read, I believe it was through Medline, that while there are significant shortages in the medical fields for physicians of infectious disease, critical care, and pulmonology, we're seeing a drop off in the need for internal medicine and fields like that at this point in time. So while we have a shortage of a certain specialty, we've got furloughs happening in other specialties. So we can see that there's kind of a dissonance here. I can say there are still lots of medical care, as Congressman Heck said earlier. There are still healthcare providers who are out of work, have been furloughed or lost jobs due to COVID-19, due to postponement of services or changing in budgeting, or just the result of how the virus has changed healthcare so far in the United States.
Hundreds of thousands of healthcare providers still out of work, as a matter of fact, nationally. Lauren.
Thank you. This question comes from Dan and Lacey and was sent in through constituent mail. The coronavirus crisis has exposed the serious problems of having the majority of our medicines and personal protective equipment manufactured outside of the US. What have you and Congress done to encourage and require our medicines and PPE to be manufactured within the US? Congressman Heck?
Well, Dan, again, sorry to be a little bit of a one-trick pony here, but that provision was included in the HEROES Act. Not only the requirement that the Defense Production Act be mobilized for domestic manufacturing of this equipment, but also some additional features which I think you'd be interested in. For example, a requirement that pharmaceutical companies fully report and disclose where their manufacturing is taking place off continent. And so there were measures included in the HEROES Act to get a handle on this. And indeed, I hope that when we get to the other side of this, and even before, we'll engage in what, in I suppose, a battlefield circumstance you would call an after-action debrief, where we really document the lessons learned and take the corrective actions necessary to avoid the kind of problems that we've had thus far. And obviously, production of PPE, but it also extends to drugs, and the concern that there isn't enough domestic manufacturing to step up and provide for what it is that we are going to need here. Lots of flaws in the current system as we have structured it have been revealed by this pandemic.
Thank you. We have one last question, and then I will turn it over to the two of you for closing comments. Our last question comes from Carrie, who is watching live. What about the suffering from having the economy shut down? Suicide rates, losing jobs, losing our homes? Congressman Heck?
Very real, Carrie. People are losing their jobs, they're losing their homes, they're losing their businesses. And the truth of the matter is there's no question in my mind that we're going to have a spike in mental health needs because of the stress brought about by it. There's no question whatsoever. It's part of why I was so passionate about the need to pass the HEROES Act and the provisions that it had to mitigate this circumstance and to hold people as harmless as is possible for as long as it's possible. You know, the truth is, Carrie, we're going to get to the other side of this. I am convinced that we will at some point develop a vaccine. It's not going to be overnight. First of all, we have to go through these phase 3 trials, which we're in now, and somebody is going to come up with something, I believe. And I'm not a scientist, not qualified to say this based on scientific literature, but on, frankly, faith, that we're going to develop a vaccine, and then we're going to manufacture it, and then we're going to distribute it, and then we're going to be to the other side of this pandemic. And so the question really is, what are we going to do between now and then to make sure there is as little harm done to American families as is possible? You know, that old saying, an emergency break glass. Well, I think we're in an emergency, and I think it's time for Congress to break the glass and to pull out the stops. We need to pass the HEROES Act or some version of it. We need to extend unemployment. We need to provide rent relief. We need to direct the activation of the Defense Production Act. We need to provide hazard pay to frontline workers. And we need to provide additional assistance to businesses, especially small businesses, so that we can bridge this terrible experience. Carrie, you're right. There's a lot of pain and suffering out there as a consequence.
It is true, and the HEROES Act would make such a big difference for so many people and reduce the stress and the suffering that people are feeling as a result of COVID-19. A few months ago, there was a emergency room physician in New York who completed suicide as a result of the emotional burdens and this absolute unbelievable stress of watching so many people suffer and die with COVID-19. And we in the healthcare field are not immune to it. We are experiencing very similar psychological distress from dealing with COVID-19. I'm also hopeful that we'll come out from the other side of this, and we'll have hopefully learned from what's happened, and we'll have made some changes in how we operate here as a country and within our healthcare systems.
Thank you both so much. And that concludes our town hall with Nurse Heidi Kennedy. I'll now turn it over to Ms. Kennedy and then Congressman Heck for any closing thoughts or comments. Ms. Kennedy?
I would like to say thank you, Congressman Heck, for providing this platform for myself and for the Washington State Nurses Association. We have been fighting, like I said, since the beginning to have healthcare workers on the front line represented and feel heard in our concerns. And I think we can rest a little easier feeling that we are being heard, at least in District 10, and that our concerns are considered valid. So thank you for allowing me the opportunity to speak with you and the constituents about some very current and pressing issues.
Well, you're more than welcome, Heidi. More importantly, thank you. Thanks for being here today. Thank you for what you do every single day. It's so appreciated. Thank you all for joining us. Again, this was the 19th. We've got the 20th Teletown Hall coming up next week. Give you a little bit of a preview. It is on Wednesday, August 12th at 3 p.m. And our guest will be Robert Ezell. He's the head of emergency services at the Washington State Military Department. And they are right in the middle of an awful lot of the considerations that we have been discussing here today. Again, Heidi, to you, thank you, and to the viewers. I am so grateful that you have given of your most precious commodity, your time. Mask up, wash your hands, maintain social distancing, and be safe. Thank you.
Thank you very much.